If someone got flu, got very sick, and died, what would they die from?
Most of the time, people who get the flu who die from a secondary bacterial infection that attacks the body while your resistance is low from the first influenza infection.
In the 1918 epidemic, there were probably 2 bacteria, maybe 3, that were causing a lot of the pneumonias. Today we know as pneumococci, Haemophilus influenza, and maybe even a little bit of staph. Is that true?
Those are the bacteria that are very common, and those are the ones that certainly were the most common cause of death during that influenza pandemic.
Doctors at the Rockefeller Institute actually created like an anti-sera against pneumococcus 1 and 2, and they were actually treating pneumococcal pneumonia there. It's somewhat successful.
They were able to control the pneumonia and help people recover from the pneumococcal pneumonia during those years. Many different approaches have been taken over the years. At this point in time, we have sophisticated antibiotics that help us fight these infections much more successfully than back in 1918.
Also, at that time, they would get these terrible infections around the lung, and they would have pus pockets around it. And surgical technique that we even do today to relieve the pus from empyema are still being one of the treatments we would do if you got that kind of an infection. Is that true?
That is true. When certain types of pneumonias hit, pneumococcus for one example, staph for another, what occurs in the body is that fluid and eventually pus can accumulate around the lung. That fluid and pus needs to be drained from that area when the amount of the fluid or pus is too great, because it makes it very difficult for the patients to breathe, and it also makes it more difficult to fight the actual infection.